You are watching the DOCTALK show.
Thank you, Professor Rhoda Wanyenze, public health specialist, and we are discussing COVID-19 now that we are out of the lockdown. Our social media handles, the DOCTALK show, that is on Facebook, Twitter, and YouTube. I know some of us have been following social media lately. There is a talk, it's better expressed in Uganda. Kalink mukasharing banange. Please share the link with your family and friends. This is very, very crucial information that would really mean a lot to many Ugandans. So do not allow them to miss out. Share the link. Go and like our pages and then share this show. Prof, I've just been reminded. When I was in medical school, we talked about health, and health is not just the absence of disease or the absence of COVID, but actually health encompasses our spiritual well-being, our economic well-being, our social well-being, and many of those aspects. But I know for such a long time we've been looking at just the presence or absence of disease. Can you please address COVID in light of actually health? Yes.
Yeah, thank you, Gavin, and you're a good student. I'm encouraged.
Yeah.
That's been one of my challenges with the COVID and what it has put us through. COVID has really distorted what we mean by health, and especially public health, because like you rightfully put, health really, it's physical, it's mental, it's social well-being. That's when we say we have well-being, but it's not just absence of disease. So, but what COVID has put us through has been so challenging that we are so excited when we don't have disease, which is excellent. We don't want to have disease. We don't want to have COVID. But health is actually bigger than that. And sometimes we say we are balancing health and the economy. But from the public health perspective, if we have no economy, we don't have health, actually. Yeah. So, and I think these are the issues that we have to talk about. Because in public health, we talk about what we call social determinants or determinants of health. You know, there are those things, if we don't get right in our environment, make it very difficult for us to have health and well-being. And by the way, education that we've been discussing is one of those. Wow. Education is one of the biggest determinants of well-being and health. It's been associated with life expectancy, good, feeding practices. It's been associated with so many disease conditions and morbidity, mortality. So when we disrupt education, and for so long, we pay a big price for a very long time. When we have issues with well-being, survival, livelihood, we have problems. If people are not able to feed well, in the next few years, we shall be getting into malnutrition again. The indicators will go down. Yeah. So COVID has disrupted the social determinants and other determinants of health and well-being. And we need to look at it in a holistic manner, especially as we move towards the recovery period. That is really, really going to be crucial, because disrupted determinants of health today is disease and death tomorrow. And it could actually be worse, depending on how we handle it. So as part of the recovery plan, we need to be thinking about how we can stabilize now, even as we try to come out of the pandemic, but especially how we can create that resilience, not only for the health system, but also that resilience for the communities and families so that they can survive, because that is really crucial. It's part of health. And we can't afford to forget that, even as we try to eliminate COVID.
Wow, and still picking up from that, I know you were talking about education before, and what we have in place so far is trying to get as many vaccine doses as possible. Yeah, but, and this may actually mean that the students are going to stay home for a much, much longer time. On top of the vaccine, in your view, what would be the other things that would engage or would deploy so that actually students can resume school? Of course, one would talk about online education. That may not be something that would be easily implemented for all Ugandans. So what are some of those things we can look at?
So I would look at vaccines as part of a package, because in public health, we always advocate a combination of interventions, especially when you're dealing with a complex condition like COVID. Vaccines, super, they are fantastic. And I'm so excited to hear that we are going to procure vaccines for millions of students and other people out there. But it is going to work in as much as we combine it with other interventions.
Wow.
Like I mentioned, there are people that will opt not to be vaccinated.
Yeah.
Unless we say, if you're not vaccinated, don't come back to school, stay home. And then we have to think about who are we leaving behind because they've refused, or are we going to make it mandatory? There is that, but there is also just the space of time it takes to roll this out to everyone. Right now, the only vaccine where we have evidence that is safe among children, especially below 18 years, is the Pfizer vaccine. It's 2 doses. So if you're going to vaccinate more than 10 million children out there, it means you're going to roll it out 20 million times for their first dose, for their second dose, and then I hope it can be sustained for quite some time. If it's not sustained beyond 1 year, then it means the following year we shall roll out again.
Yeah.
So it is not a small undertaking. So even as we think about it, we cannot afford to abandon the other package of interventions. And that the sooner we actually think about how those other interventions can be wrapped around the vaccination, the better. Because right now I'm happy that we've started with the teachers among the priority population. So if the teachers are done, how do we deal with the vaccination among the scholars so that then we can combine it with other interventions and perhaps get this rolled out faster?
Wow.
It is a very complex area. Nobody has the perfect solution, but we know that it can be done because I mentioned Israel, which was among the first countries to really rapidly scale up vaccination. When they covered their adult and most vulnerable populations, they started opening up. They didn't necessarily wait until all the children were vaccinated. And so because it's a very complex undertaking, it takes quite a bit of time. One has to be looking at it as part of other interventions, not the only intervention that's going to unlock the schools for us. And I will go back to what I was emphasizing, that we need to learn to play hide and seek.
Yeah.
It's going to be innovative ways that we can creatively come up with between education, between health, between the communities, between the parents and the families. How can we do the hide and seek? And how can we mix in these interventions so that we can keep our children going to school? You talked about online. Yeah. Education is not just about knowledge. Education is a wholesome activity that includes socialization, so that children learn how to interact with other people. They learn how to keep their environment clean. They learn, they are able to play and many things. So you can't just substitute all those things with online teaching. It's not enough. There are online games, but that's again different from an actual physical game out there. So education is not just about knowledge. It's really nice that we have innovations like having, these newspapers and online for those that are privileged to be able to afford the bandwidth and to be able to do online training, but that's not going to do it. That's why we need to be thinking again about our homegrown solutions in terms of how we can have this combo that we can add to our vaccines and be able to get the children back to school.
Wow, this has been very, very enriching. And what I'm picking from you, Prof, is that actually vaccines themselves are not enough. You and I are very crucial in this war. SOPs have never been as important or more important as they are today. The masks, social distancing, the hand hygiene, avoiding social gatherings as we try to get out of this. So it's a responsibility for the mother out there, for the father watching me, for the young person listening to me this evening, and for all of us, the matatu or the taxi driver, the boda rider, all of us have a part to play in this. It's not an issue of the government of Uganda. No, this particular enemy is an enemy whereby all of us are being recruited into this army of fighting this war. As we come to a close, we were told last year that actually children do not need to be vaccinated. children, I think 18 years and below. So where are we now? Are we vaccinating children? Are we vaccinating young people below the age of 18?
So initially, children were not included among those to be vaccinated simply because we did not have sufficient evidence of effectiveness and safety of the vaccines among children. So, but right now we know that trials have been completed and the Pfizer vaccine has been found to be effective and also safe among children. And in the US, children are already being vaccinated, and several other countries, a few considering so, moving towards vaccinating children. For the other vaccines, we don't yet have all the evidence of the safety, so we have to hold it until we are comfortable that our children can be safely vaccinated with those vaccines. But like I said earlier, even when we say it's safe to vaccinate children, we have to consider issues of equity. What is the best way to deploy vaccines if we don't have enough for everybody? The best way to deploy vaccines is to start with people that are at highest risk of severe disease and death. And when we do this, then we really deal a dent to the pandemic, because we protect the people that are most likely to die. And that's what we need to start with. So even as we move to our children, let's not forget and crowd out this group. Otherwise, we will have children vaccinated back in school. There will be so many people still dying because they have not yet been vaccinated. We need to keep that high on the agenda. I would be more comfortable if we actually mopped up all the people that are older, all the people with underlying conditions that are likely to get severe disease and die, and then quickly moved on to that age group. I would be much more comfortable with that. But I would be very uncomfortable if we skipped some people and went to the children, much as we would like them to go to the schools. So we need to be thinking about this vaccine rollout in the children as a combination with other interventions, and we need to be thinking about the entire broader response and the role that the vaccine is going to play amidst this, so that we can deploy them in a manner that they can give us maximum benefits and maximum benefits for everybody in an equitable manner. And when the vaccines become available and it's your turn, please come out and vaccinate. Don't discourage other people from vaccination. Vaccination is a critical intervention in this pandemic.
Yeah, thank you very much, Professor, for sharing this very interesting knowledge, and it's been very empowering. Please, in a minute, what's your punchline?
First, I would like to say that many of us are happy that we have some space. People have been complaining they wanted to come out. I'm happy that we are able to come out, frankly. But just remember, Delta is out there. It's everywhere. It doesn't make a sound. The person next to you, even you yourself, could actually have it. This is a highly infectious agent right now. And as we have seen from this second wave in Uganda, people can get really sick and many people can die. Let's take responsibility so that we can sustain this freedom. It's in our power to make sure that we can sustain it by what we do. The procedures, avoid crowds. Please don't call people to your home and have silent parties. Let's leave to have those parties at some point in the future. Please avoid meetings and workshops at the workplace, those large meetings, serving food in meetings so that people can't even protect themselves because they have to eat. Let's do something. We have it within our power to make sure that we avert the third wave. If we don't do that, we have Delta, we don't have many people vaccinated out there, we will be brewing the third wave, but we have the power to stop it.
Thank you so much. My take home from this, remember, the wave is actually entirely determined by us. It's not something in the space, but it's determined by our behavior. So it will be up to you and me to delay or fasten the arrival of the next wave. The SOPs cannot be overemphasized. Avoid large gatherings. Keep your mask on. Strict observance of hand hygiene. And be sure one of these days, this thing will be a thing of the past. Thank you for joining us this evening. Once again, remember our social media handles, the DOCTALK Show on Twitter, on Facebook, and YouTube. Share the link.
The Ministry of Health informs the general public that amidst the difficult times of the pandemic, routine immunization for all children under 5, those eligible for HPV vaccines, and women of childbearing age is still going on in all our health facilities. Parents and caregivers, take all your children for immunization as per their schedule. All vaccines are safe, effective, and free. Remember to observe the COVID-19 prevention measures as you go for immunization services. Wear a mask properly, covering your mouth and nose. Wash your hands regularly with soap and clean water or use an alcohol-based sanitizer. Maintain a physical distance of at least 2 meters from others and avoid crowds. This message is from the Ministry of Health with support from partners.
The DOCTALK Show.